Hi and welcome to the Brenda Cartwright & Associates YouTube page. Today we will be discussing the Silverman Voice Treatment. This treatment is now being offered in person and online at Brenda Cartwright & Associates. Before we get started, I wanted to introduce myself. My name is Marisol Thornberry. I'm a licensed speech-language pathologist. I work for Brenda Cartwright & Associates. Typically, we specialize in cognitive therapy, but I am also a certified LSVT provider and a certified LSVT provider, which means that I can offer teletherapy services. Throughout this presentation, you will hear me refer to the Silverman Voice Treatment as LSVT. Please know that they are the same thing. It's just a little quicker to say the acronym. First, I wanted to start with the history of LSVT. So the lovely lady that you see on your right is Mrs. Lee Silverman. She's the namesake of LSVT. Mrs. Lee Silverman was a woman living with Parkinson's disease in the 80s before there were really any effective treatments for communication. When Dr. Lorraine Ramig, who's the primary researcher for LSVT, met Mrs. Silverman's family, the primary wish from her husband was, if only we could hear and understand her. That's exactly what LSVT sought to do. Since 1987, when they first met, a large body of research has been published on LSVT, making it the gold standard treatment for communication difficulties in Parkinson's disease. So what on earth is LSVT? LSVT is a communication intervention that primarily targets vocal loudness. It was specifically designed for individuals with Parkinson's disease who are having difficulty communicating. However, there is a new body of research that shows that it can be useful for individuals with other neurological conditions, such as ataxic dysarthria, atypical Parkinson's disease, and it can also be useful for certain pediatric populations. Prior to the creation of LSVT, there weren't any highly effective treatment methods. They were mostly focused on articulation and speech rate, and they had a low intensity dosage. So when I say dosage, I mean how often the person was seen by their provider. LSVT differentiated itself by targeting that vocal loudness in addition to high effort, maximum performance tasks with a higher dosage of treatment. So they were seen more often than what was typical. LSVT's primary goal is, again, increase that vocal loudness to help individuals with Parkinson's disease return to a normal loudness. But research has also shown effects on articulation, how one says their speech sounds, intonation, which would be stress and emphasis, intelligibility, how easily someone is understood by others, self-perception of communication skills, so how the person with Parkinson's feels about their ability to communicate, and there is some impact on facial expressions as well. So you might be thinking, okay, why does loudness matter so much? Individuals with Parkinson's disease have difficulty with their sensory system, specifically with sensory feedback. So they have difficulty judging how loud they are, or how fast or slow they're speaking, or even how big or small their movements are. They may believe that they're being appropriately loud based on their own self-perception, but their family hears a mumbling, soft voice. So no, this intervention does not teach you to shout at people. It teaches you to recalibrate your sensory system. So on the screen, you see that the primary target is loudness, as we've discussed. The mode or the treatment method is an intensive dosage, meaning 4 sessions for 4 weeks with expected high effort performance. We need this intense dosage and high effort to really take advantage of the brain's neuroplasticity, which is the brain's ability to create new long-lasting connections. Finally, we have calibration, which goes back to that sensory system, helping the sensory system recognize that this louder voice, although to the person with Parkinson's seems extreme, it's really the new normal volume for them to be understood. As I mentioned on the previous slide, treatment is 4 days a week for 4 weeks for a total of 16 treatment sessions. Each treatment session is 60 minutes. Again, this seems like a very intense dosage, but in all honesty, it's because it is, and we need that intensity to help with neuroplasticity and that sensory feedback for recalibration. Research has shown that when these sessions are reduced, either by time, so instead of 60 minutes, 45 minutes, or by weekly duration, so instead of 3 visits a week, instead of 4 visits a week, 3 visits a week, outcomes just really aren't the same. That intensity is really needed. In addition to the 16 sessions, there is daily homework. Yes, even on the days that you have sessions, they're not usually long, about 15 minutes at most. This helps with intensity and generalization into the home setting. You don't want your loud voice to only be used in the clinic, right? That wouldn't be as useful. Prior to treatment, there is an assessment session where some of the exercises are trialed. There's also a thorough case history. It's recommended that each individual who receives this treatment prior to receiving LSVT visit an otolaryngologist or their medical provider to visualize their vocal folds. We wouldn't want to be doing this treatment method on maybe laryngeal cancer or something that we could have missed otherwise. Each session follows a set outline. So sessions begin with the practice of a sustained ah with a good loudness and vocal quality. There are also high pitch and low pitch ahs, and then functional phrases done that you would generate yourself. They should be things that you say often so that you can practice that loud voice with those frequently said phrases. Finally, there are hierarchy exercises. So these are designed to help with improving generalization. They increase in complexity as you continue through therapy. So you might start with one-word answers and then move to phrases and sentences, and maybe there's some reading involved. So it gets a little bit harder as you continue. There's also, you can add cognitive exercises and different types of tasks to help with maintenance of that loudness when other things are in the way. This concludes our discussion of the Silverman Voice Treatment, otherwise known as LSVT. All information used in today's video was gathered from LSVT Global website and LSVT LOUD certification program. Please remember that if you are going to receive LSVT, it has to be completed by a certified LSVT provider like myself. If you're a patient who is interested in receiving treatment, our contact information is listed below. You can visit our website at brendakurtwright.com or call us at 813-252-6334. If you would like to know more about LSVT or you're interested in LSVT Big, which is the physical therapy program, you can visit their website, lsvtglobal.com. We wish you well and we hope to see you soon. Thank you so much for listening. Bye.